Welcome everyone. I'm excited to kick off today's session with episode 22. This is our very first slide, so I just want to warmly welcome you all and thank you for being here. Today, we'll be exploring some interesting topics that I think you'll find really valuable. We'll briefly go over what's coming up, covering key insights and main points, so stay with me. Let's get started. Let's look at this scenario. Jessie was admitted to the hospital weighing 210 pounds. After 2 days of diuretic therapy, her weight decreased to 205.5 pounds. This weight change gives us an estimate of how much fluid Jessie has lost. Now, the question is, which of these options best represents that fluid loss? We need to think about the typical weight-to-fluid conversion and what that means in terms of volume. Remember, a common approximation is that 1 kilogram of weight loss roughly equals 1 liter of fluid lost. So, understanding Jessie's weight loss in pounds and converting that to kilograms helps us estimate the fluid loss in liters. This is a practical example of how we assess fluid status in patients and make informed decisions about their care. Let's take a closer look at the key concepts on this slide. First, the focus is on understanding the importance of precision in our measurements. When we talk about accuracy, we're aiming to get as close as possible to the true value. It's like hitting the bull's every time. Then, there's consistency, which means our results are repeatable over time. This is crucial because it shows that our process is reliable. Now, connecting these ideas to the overall theme, it's clear that maintaining high standards in measurement impacts the quality of our outcomes significantly. Whether we're in research, manufacturing, or quality control, these principles help us ensure that our results are trustworthy and valid. So, always remember, striving for both accuracy and consistency is fundamental to achieving excellence in our work. Now, let's talk about how we estimate fluid needs in clinical practice. A useful rule of thumb is that approximately 1 kilogram of weight loss is equivalent to about 1 liter of fluid. This helps us gauge how much fluid a patient might need when they've lost weight, especially in cases like dehydration or fluid shifts. Let's walk through an example. Suppose a patient weighs 210 pounds initially, and now they weigh 205.5 pounds. The first step is to calculate the weight loss, which is 210 minus 205.5, giving us 4.5 pounds. Next, we need to convert that weight loss from pounds into liters of fluid. Since 1 kilogram equals roughly 2.2 pounds, we divide 4.5 by 2.2. This gives us approximately 2 kilograms, which is also about 2 liters. The key point here is that for every pound of weight lost, we can estimate roughly half a liter of fluid deficit. This conversion helps us tailor fluid replacement strategies effectively, ensuring our patients stay properly hydrated. Remember, understanding these conversions is essential for accurate and safe fluid management in clinical practice. This is a common nursing exam concept related to fluid balance and diuretic therapy. When we consider fluid loss, in this case, it's estimated to be around 2 liters. This figure is important because it helps us assess how much fluid a patient is losing and whether their therapy is effective. Understanding fluid loss is crucial for maintaining the patient's overall fluid balance and preventing complications like dehydration or electrolyte imbalances. Throughout this presentation, we've emphasized how vital it is to monitor fluid status carefully, especially when administering diuretics. By accurately estimating fluid loss, we can make informed decisions about adjusting treatment plans to ensure optimal patient outcomes.